In this video, we're going to be discussing the benefits of fluoride, how you can get that fluoride at home, as well as how you should be getting it in your dental office. Hey y'all, I'm Amy Morgan and I'm the marketing coordinator here for Pediatric Dental Associates and Orthodontics. And today we're going to be talking about the benefits of fluoride. We're going to be discussing how you can get that fluoride at home as well as in your dental office. And if you find this information helpful, go ahead and hit the like button, leave us a comment below if you have any other questions, and also make sure and hit the bell so that you get notifications every time we upload a new video. So obviously here at PDA&O, we really focus on lowering the risk of cavities. And one of the ways that we can do that is by fluoride. You can get the fluoride in the office, and you can get it at home, and we're going to discuss that here in a little bit. But we want you to know what the actual benefit is of having fluoride. You see it in the toothpaste, you have it if you have city water, you're seeing it there. There's even some bottled waters that come with fluoride added because they want to make sure that you're still getting that fluoride intake. And the reason why this works to lower cavity risk is because it actually increases the acid resistance in everything. So think about it, if you're drinking orange juice has a lot of acid in it, and this, having your fluoride applied correctly and using it on a daily basis, can actually help the acid from that orange juice not affect your teeth as bad. And so you want to make sure that you are getting your fluoride intake not only at home, but you're also following the dentist recommendations and getting it 2 times a year in your dental office. As a parent, you may be wondering, how can I make sure that my children are getting the appropriate amount of fluoride? You can find this in their regular toothpaste. So when you're shopping for their toothpaste in the store, you want to make sure that you're looking for something that includes fluoride. And then based on their ages is the amount of toothpaste that they'll use. So if they are under 3 years old, you're just going to use a smear size amount of toothpaste. That's all that they need. And that will be enough fluoride intake for them to have if they're brushing twice a day. If they're over 3, you want to use a pea-sized amount. So this is just ensuring that maybe they don't swallow too much of that toothpaste, but it still is allowing enough fluoride and enough toothpaste to properly clean their mouths. When it comes to receiving fluoride in the dental practice, most likely your child is going to receive a prescription strength fluoride known as fluoride varnish. This is actually just painted onto the surface of the teeth after they have already had their cleaning, their x-rays and everything. So this is done completely at the end of the dental visit. And the reason that we do it in the office as well as after the cleaning is because all the tartar and all the plaque has been removed. Some of the dental tubules in the teeth have been opened up, and this allows for that prescription strength fluoride to be able to seep into the teeth and really act as a cavity reducing agent, okay? So it's really important that you have this fluoride varnish placed twice a year. This is a recommendation by the American Academy of Pediatric Dentistry. Our office follows these guidelines and always recommends to parents that you do have this varnish placed twice a year. Sometimes you may not want to have your child have the fluoride varnish due to insurance, okay? So sometimes insurances have not caught up with the times, they haven't caught up with AAPD guidelines, but we as an office and the AAPD still feel very strongly that you have 2 treatments of fluoride varnish per year. So we know that that can be an out-of-pocket cost, but we do feel like the benefits of the fluoride actually outweigh even their cleaning. So we would rather you push to have the varnish placed even over the cleaning. But again, the varnish works best after a cleaning. And actually the cost of fluoride varnish is actually very minimal in comparison to the entire dental visit. In addition to preventing cavities, it can also reduce sensitivity. As you may know by now, here at PDA&O, we really strive to educate parents. So we just want to make sure that you understand that our stance on fluoride comes directly from the guidelines put forth by the AAPD. You can also find a lot of other resources at aapd.org. We also would like for you to understand that not all dental offices are the same, and that your dentist may not have the same recommended guidelines that we do, but we want you to understand that all of our guidelines come directly from the American Academy of Pediatric Dentistry. We know as parents you may have a lot of questions. There are tons of information out there. You can find everything on the internet from one end to the other. We want to make sure that you know that we are an educational resource for you. So feel free to reach out to us. You can contact our office. You can leave a comment below, or you can always direct message us on any of our social media platforms. We are here for you, and we want you to have the information that you need to take care of your child's oral health care.